Bankruptcy, closures, reduced services. Officials say going out of business is the potential fate of hospitals across our state that are struggling with a financial crisis.
Fox 13's Frankie Thompson has been looking into this issue. And Frankie, for some hospitals, this sounds really dire.
Yes, 97% of hospitals across the state participated in a financial survey conducted by Washington State Hospital Association. Officials reviewed financial reports from the first 6 months of 2022. The result, unsustainable losses that could affect the people who need health care.
And our biggest concern here is it's putting patient care at risk in many communities across the state and jeopardizing patients' ability to get the hospital care that they need.
The association says its financial survey revealed hospitals in Washington had a net loss of $1.75 billion during the first half of this year. Total operating expenses alone increased by 11% compared to 2021.
This 12% net loss is unsustainable. We are already seeing service cuts, limits on hospital admissions. As possible, without action, we could see hospital closures. We already have fewer hospital beds per capita than any other state. Once a hospital closes, that community will not have access to timely emergency and specialty care.
The association says lack of funding is causing hospitals across the state to reduce care. Officials say hospitals in Yakima are reducing the number of beds. Services in Whidbey Island are scaling back. The CEO of Overlake Medical Center in Bellevue says they closed one of their urgent care centers.
We do frequently find ourselves looking at our surgery schedule and considering postponing surgeries in order to open up a surgical bed that can manage a medical patient that comes through the ER, and which is a major inconvenience to the individuals who need the surgeries.
The association says hospitals were already operating on tight budgets, even with the support of federal COVID-19 relief funds. But that money has run out, and the new losses are due to staff shortages and high inflation causing the cost of labor, drugs, and supplies to rise faster than payment rates.
All at a time that reimbursement's been stagnant, no increase in Medicaid funding in 2 decades, 20 years, at a time that Medicaid's only paying maybe 2/3 of the cost of care.
Officials with urban hospitals say one big burden draining their budgets, discharging patients who no longer have a medical need to stay in the hospital. UW Medical Center has more than 175 of these patients ready for discharge, but instead, they have to receive continued care at the hospital because there are 2,000 to 3,000 beds at long-term care facilities closed across the state.
And while they're awaiting discharge, we receive little or no reimbursement for our services, despite costs of over $1,600 a day in an acute care setting.
The Hospital Association has proposals for legislatures to help in this financial disaster. Officials say they're asking lawmakers to significantly increase Medicaid payments to hospitals by more than $1 billion a year. They also hope to see more support for long-term care facilities and staffing across the healthcare system. Back to you.